Muscular dystrophies. In the muscular dystrophies, we have numerous disorders, but as far as NEET PG is concerned, we need to know about only two disorders mainly. One is the Duchenne muscular dystrophy and the Becker's muscular dystrophy. Very few points, very superficial, comes in your exams. So we'll just brush over this topic in a very short period of time. So first is the Duchenne muscular dystrophy. It is the most common inherited neuromuscular disease. So this is an MCQ. It's the most common inherited disorder. X-linked recessive. Again, this is important. The inheritance of Duchenne muscular dystrophy, as you can understand, if this is an X-linked recessive disorder, so it will be more common in males. So we have the DMD gene involved, and that is XP21.2. So age of onset of manifestation is 2 to 5 years. We can get gait disturbances at 3 to 4 years, and the gait is waddling gait. The child will have frequent falls. The history comes like this, that there are frequent falls. You see the child to be toe walking. There are features of myopathy, difficulty in climbing upstairs, difficulty to get up from a sitting position. Weakness of the flexures. So neck flexors are weak, difficulty in climbing upstairs, toe walking, frequent falls, and lumbar lordosis. All this you get in case of Duchenne muscular dystrophy. And one thing that you get, it is classic of Duchenne, but it is found in any proximal myopathy. So any proximal myopathy, you will have difficulty in climbing upstairs, difficulty in getting up from sitting posture. There will be frequent falls. So this is the classic picture that you get in your exam. This is known as the Gower sign. This is the first picture. So you just follow this trail. See, in the first picture, the baby was sitting in the ground, the child. Then the child is trying to get up. How is the child trying to get up? The child first takes the support and of the two upper limbs. Then the child gets up a bit. Then he tries to stand up. Again, with the help of the upper limb, the child finally gets up. So this is a classic demonstration of the entire Gower sign picture. So this is definitely, you find it in case of Duchenne muscular dystrophy, but this is not specific of Duchenne muscular dystrophy because you find it in case of any proximal myopathy. So this is an image-based question. Suppose you're asked, ki, a 5-year-old child comes to you with this, and his elder brother also suffered from this illness and died. And there is, when you inspect the calf muscles, there is pseudo hypertrophy of the calf muscles. What is your diagnosis? The answer will be DMD. See the clues in the question. The first clue you got is this picture. That tells you, okay, you are dealing with a myopathy, a proximal myopathy. The child is having difficulty in getting up. So you understood this is a Gower sign, which is positive. Next clue. Elder brother died of the same illness. Elder brother, that means male. That means it's an X-linked recessive condition. Died, that means the myopathy has progressed, and usually we'll just read there is so many problems and it can result in death also because it is not a good prognostic condition. And number 3, it was also there that when you inspect, you found pseudo hypertrophy of the calf muscles. So all these 3 constellation of all the features, you can say that this is a case of Duchenne muscular dystrophy, the most common inherited neuromuscular dystrophy in children. So Gower sign frequently seen in children, can appear at 3 years. Indicates proximal muscle weakness affecting the pelvic girdle. So there will be pseudo hypertrophy of the calf muscles. Most commonly, it's the calf muscle affected, and tongue. We'll have the valley sign, and the contractures can be there. Average time of death is 15 to 20 years. Because around 12 years, the child becomes wheelchair bound. Wheelchair bound by 12 years of age. And the cause of death is respiratory insufficiency plus cardiovascular involvement. Okay. So these are the cause of death. So only 5 or 6 things that you need to remember from here. Understood? Next is the Becker's muscle dystrophy. So it onset after 5 to 7 years of age. So boys remain ambulatory till late adolescent. Here, so Duchenne muscular dystrophy, a 5 or 6 year old boy comes to you, you understand. But for understanding Baker's muscular dystrophy, the usually it around 13